Welcome to all of you at this event, side event to the conference, Rethinking Aid, Responding to Humanitarian Crisis in Times of Growing Challenges. It's a pleasure to be with you, all here in this room, also online, with colleagues here, part of this really interesting panel. I have the privilege to open this event as co-organizers at IECAH. I'm Camille Nussbaum. I'm Executive Coordinator at IECAH, the Institute of Studies on Conflicts and Humanitarian Action. And we organize this event with our colleagues and friends at MSF, Doctors Without Borders. And again, it's a great privilege to be with you and to have this opportunity. What we wanted with this event when we presented this to the organization of the conference was really to have this space to have the humanitarian perspective to this much bigger debate during the conference about funding the whole development. Humanitarian action is obviously quite specific. Many times we really want to differentiate what is humanitarian and what is more mid-term, long-term responses to different challenges. But obviously there is an important connection, is to work most of the time in the same places and do our best to serve, to help the communities we work for and we work with. So this is it. We'll have an interesting panel. My colleague Raquel will be the one moderating this debate. And let's start.
So thanks a lot, Camille. Thank you very much for your attendance today here. As Camille said, we really wanted that humanitarian aid to be as well as a part of this international conference. Of course, it's got a broader scope, but unfortunately, we find that most of the population that are in the worst crisis, they usually need humanitarian aid first. So we think that we wanted to reshape the conversation to focus on the people and on the populations that need this extreme help in a very, very acute moment. So just to give a quantitative data, there's been a study published in May, just 1 month ago, in the Lancet, that this study warns that just the cuts of US aid will cause 4 million deaths by 2030. The researchers pointed out that there is a risk of abruptly halting or even reversing 2 decades of health progress in vulnerable populations. In addition to the US administration decisions, the recent cuts of the ODA of other donors such as the UK, France, the Netherlands, Belgium, or some other are pushing both humanitarian and development systems to the brink of collapse. So this is just one part. This is only the financial part, but in this session we will address not only the funding cuts, but also we will provide a broader scope. And we are going to begin now with the first block of interventions. So you will have, dear panelists, 5 minutes more or less for interviewing. And we will begin with Anja Nidje. She's the head of partnerships and resource mobilization from the United Nations Office for the Coordination of Humanitarian Affairs. So Anja, really a pleasure to count on you. So the floor is yours.
Thank you so much, Raquel, and thanks so much for being here with us. This evening, someone had promised me air condition. We're still waiting, I think, but definitely the heat is on, I think, in many aspects. So really lovely to have this opportunity today to join the discussion and also hopefully engage with you later on this really interesting topic of rethinking aid in times of growing challenges. Raquel, you have already said that the humanitarian perspective is not necessarily reflected in this big conference. And that, of course, has reasons. And also, as you said, it is because of our usual thinking more in silos, where I said, okay, this is development financing and this is humanitarian, and they're coming from different sources. And they are not necessarily linked. But of course, we know this is not the reality. Reality on the ground is that people threatened by humanitarian crises or stuck in humanitarian crises are the ones that are first hit by any type of conflict, emergencies, etc. They're most vulnerable, but they're also usually not at the table, and they're not in these conferences. So very happy to have that opportunity to bring this perspective a little bit, but overall, of course, it also demonstrates the whole notion that we have seen that we need to really rethink and also redo the whole system, because we are not reflecting reality on the ground. We're operating in an increasingly fragmented humanitarian landscape. You know that humanitarian law is being eroded. Multilateral cooperation is weakening. We're getting tweets every day on this. Aid is becoming increasingly politicized. And today we have over 300 million people all over the world that are in need of humanitarian aid. However, the whole system is really seriously under strain. As the emergency relief coordinator, Tom Fletcher, who is also the head of OCHA, said, we are severely underfunded, overstretched, and under attack, literally under attack. So underfunded. As you know, we are asking for support through our global appeals, the Global Humanitarian Overview, launched at the end of last year. And, trying to bring assistance to 180 million people. This is out of the 300 that are in need. Those are the ones that most urgently need this, and they're being targeted by the humanitarian system. However, at this point, coverage of funding for the global humanitarian appeals is only 13%. So this is almost $3.4 billion less, or more than a third, than what we had seen at the same time last year. So you can already see we are missing at least a third of the funding that we would usually see. Overall, of course, humanitarian affairs or humanitarian response has always been low funded. For the last few years, we have always been hovering around 50% by the end of the year. However, again, what we're seeing now is definitely a picture that has turned from bad to worse. And this is because of really brutal funding cuts, as Raquel said, not just from the US, but actually quite a number of European donors. And the biggest funding gaps at the moment, of course, are caused by the United States, but also by the lack of funding from Germany, for instance. So this means that millions of people are left without the life-saving support that they so urgently need. I already mentioned we are looking at a contraction of the sector of at least 30% this year. And you will already have seen all the messages around the large-scale layoffs in the humanitarian sector and the suspension of life-saving assistance programs across the world. And I'm sure that my fellow panelists will also talk more about this. I also mentioned that we are overstretched. So 300 million people, I said, they require humanitarian assistance this year in 72 countries. However, this target is way out of reach, given the funding cuts, but also the complexity of the different crises that we are dealing with. Access constraints to populations in need have never been higher. And you can see that, of course, in the situation in Gaza. You might have heard that OCHA launched recently a hyper prioritization exercise of our global humanitarian plan overview, and then, of course, included all the humanitarian plans that are presented there. Hyper-prioritization is a bit of a euphemism, but it's really hyper. So we use two baseline criteria to identify those that would be hyper-prioritized. So first, we focused on humanitarian action for people and places that need it most, using the intersectorial severity 4 and 5 as the starting point. So this is 4 and 5 for malnutrition and food security. And you might be aware, but basically these are people that are either already close to to starvation or at high levels of food insecurity. So this was the first criteria applied. Really look at those who really needed it most to survive. And then the second criteria was around life-saving activities. That also includes protection, to make sure that we're really drilling down on these are the activities that need to happen to save lives now and in the next few months. So based on that, we have identified 114 million people that need the assistance most urgently, for a total of $29 billion US. This is only 38% of coverage of the total number in need that we had identified just a few months ago at the end of last year. So, but I already mentioned to you that current funding stands only at 10%. So even the 29 billion seems very, very much out of reach from achieving what we want to do, despite what everyone is trying to squeeze every dollar, every euro, and also hyper-prioritize. So I was there looking at what is actually even more severe than hyper. Is it super or hyper, whatever? So what I saw was you could use ultra, maybe ultra prioritization or mega. So yeah, little joke, I'm sorry. But nevertheless, of course, we know it's not all about money, what we are facing, right? I already mentioned that we are under severe attack as the humanitarian community. You might have heard that 2024 was the deadliest year for humanitarian workers in recorded history. We had 377 humanitarian workers killed, most of them in Gaza. And unfortunately, these are not isolated cases, but it is a trend that we are observing. And as we speak here today, humanitarian workers are attacked and being killed across the globe. Gaza, I already mentioned, South Sudan, Ukraine, and many more. It's also harassment, detention, and kidnapping that are becoming alarmingly frequent, with state actors often implied, at least as much as non-state armed groups. So a bit of a new trend also there, quite clearly. When aid workers are attacked or detained, operations are suspended, access is denied, and people in urgent need are left without help. In the occupied Palestine territories, for instance, attacks against workers and health facilities, coupled with the dismantling of UNRWA, brought the humanitarian response near to collapse. Earlier this month in Sudan, a humanitarian convoy attempting to reach famine-affected Al-Fashir was attacked, killing 5 convoy members and preventing life-saving assistance from reaching the people in critical assistance. So lives are lost, not only those of the aid workers, but also of the communities we fail to reach. So what else do we see in this times of growing challenges? We see political agendas distorting aid priorities. We see humanitarian space is shrinking. We see a pandemic of disinformation, especially targeting younger generations. And this is eroding trust in our work and values. At the same time, there's a growing disconnect between global decision-making and realities on the ground. I think what we are seeing today also in Seville might actually also attest to this. Local actors who are closer to communities in crisis remain underfunded and marginalized. Meanwhile, international organizations face growing scrutiny over costs and effectiveness. So what we can do, this is something we will discuss today, hopefully. But overall, you might have heard about the Humanitarian Reset, which was launched by OCHA and by our boss, the Emergency Relief Coordinator. This is a bold agenda to regroup and also reform as a humanitarian system, focusing relentlessly on saving lives with the limited resources that we have. And that is the hyper-prioritization exercise, for instance, that I mentioned, but also urgently reforming how we work, becoming leaner, more locally empowered, and more innovative in mobilizing support and partnerships at all levels. Thank you.
Thank you, Anja. Indeed, it's not only about money. No way. The figures show an extremely concerned situation for millions of people. We will come back to it afterwards, and we will go deep in this disconnection among the global decision-making and the realities of the people on the ground. But first, now I would like to introduce Mike Pfister. He's the head of the Development Center from the ICRC. So Mike, really thanks for being here today. So please.
No, thank you, and thank you for everybody who's stuck around so late on a very hot day. It's becoming a bit cooler, but the discussion is probably going to take us into the opposite direction. I think it's a very important topic. So I'm really pleased to be here because not only is the topic itself important, but it's equally important that this topic is positioned in the FFD agenda and processes. I mean, if you look back to the 2015 Addis Ababa action plan, conflict was already mentioned like 19 times in the action plan. Yet today, right, the ICRC is recording over 120 active conflicts. That's 3 times more than 3 decades ago. So which takes us back to the Monterey Consensus, actually. And on top of that, if you start looking at what are some of the consequences, our analysis and experts have identified over 210 million people that live under the full control or partial control of armed forces. Now these, and we talked about it just before the panel a little bit, these are the areas where government systems fail to deliver essential services, essential protection, no health, no schooling, no water, no electricity services. But also, and that's where my role comes in at the ICRC, I'm in charge of building partnerships with the development sector. So I don't do development, but I engage with the development sector, just to clarify that. And even there, in the development sector, the traditional toolbox, if they want to contribute to achieving the Sustainable Development Goals, the traditional toolbox will fail in these contexts. Working with government institutions, which has been the traditional way of working, you will not be able to work with these institutions to help deliver these essential services. And I think that's a very important dilemma that we face and that we have to discuss, I think, also a little bit today. Another point I really like to highlight, and this has been mentioned already in the introductions before, is the role of international humanitarian law. It is there, and despite, I would say, the underpinning of the Geneva Conventions and full consensus around the Geneva Conventions, we see, like almost never before, an extremely weak compliance of the most basic norms of international humanitarian law and the Geneva Conventions. So how can we speak even of sustainable infrastructure when schools, medical centers, water and electricity service providers are the targets of military operations? So you're completely missing the point. I mean, look at Raqqa, look at what's going on in Gaza, just to mention a couple of examples. Kharkiv, Khartoum, the list goes on. And then the question is, have you even thought about the reconstruction of this? How much this will cost? Can the world afford it today? At a time where development aid, where this reconstruction would come from, is being cut to put more money into defense and military operations. Again, strengthening the ability to destruct in a way, right? So this is really, we're entering a bit of a downward spiral, and inaction will be extremely costly going forward. So this really puts us today, and as probably a recognition that we have, and we've seen it, us in the sector, we've seen it coming for months, but it puts us today at a moment, months, even years, I would say, but it puts us today at a very critical juncture where we need to think bold. And by that, and I don't mean to think bigger, but bolder, which means let's look how our mandates, which are golden and which are crucial in the chain of delivering impact, but let's look beyond our mandates and how we can create these connections. Anna, you mentioned the humanitarian reset. Maybe later in the discussion we can discuss a little bit what are the risks of a humanitarian reset if you don't get it right, and that's precisely about making sure the mandates connect and we don't diverge. So maybe just three points in terms of going forward that I would like to highlight. International humanitarian law is there. It's a robust body of law, and although we're seeing these challenging lack of application, disrespect of IHL, there are also elements and experiences where it has worked, where it has protected civilians, where it has protected essential infrastructure. And these are elements that should inspire us to do more with less, I guess. It's an overused term right now, but I think let's look at that. And the ICRC is doing its part. It has launched a new momentum around IHL through its high-level initiative, was supported by 6 states, including a number of states from the global south, which is extremely important. So we're doing our part in pushing IHL even further. And what this means is, of course, also now looking at IHL in practice. And what obviously we don't have a model yet, if I may say so, but we have elements that show that you can de-risk investments in infrastructure in fragile and conflict settings. There's evidence of that. So let's work on that evidence and try to distill the lessons, but also why it doesn't work in most cases, but in some cases it works, and why is that so? And ultimately that leads to, again, the word partnerships, that we have to work across our mandates together. Let's not look at our own block. I know it's hard, but we need to have the full spectrum ahead of us and look at it from A to Z. What are the different steps and how the different nodes need to be connected? Those are the different points I would elaborate later in the evening today, but just by way of introduction, Raquel and colleagues. And thank you again very much. Very pleased to be here.
Excellent. Thanks very much. And for sure. Yes.
Not every time we speak is going to be
We like the clap. No, but for sure we will have more time afterwards to go into all the different aspects that you have mentioned, and also as well the interesting part of how to address the challenges we are already facing at this moment. It's also really interesting to integrate in this equation the worrying erosion of international humanitarian law and the direct impact that it has on the access to the populations. So we will develop it further. And now we would like to introduce Alberto Jodra. He's a colleague of mine. We're working in MSF. He's the head of the Center for Applied Reflection on Humanitarian Practice. Thank you very much, Alberto, for being in this table. I would like you to introduce a bit how, as a frontline organization with direct interventions in 70 countries and focus on conflict settings, how do you see the current situation? Thank you.
Thank you, Raquel. Thank you, all the people here and the people online. I would start by maybe highlighting something that I consider key when we are discussing about the way out from this crisis. No, what is happening in the sector is not the result of some policies decided a few months ago. It's not the result of decisions of a few people in offices. It's the manifestation of a collective failure at the end. It's the increasing gap between the human capacity to fork a better world and the growing amount of undressed suffering is the manifestation of a collective failure. It's not the fault of few people. It's not the fault of few policies. It's something that belongs to all of us. Which is true is that the gap is being exacerbated now by the acceleration of some trends that have been unfolding for several years, but now, as I say, they are being exacerbated by these policies. No, I will mention a few of them because Anja already mentioned some of them, but I will mention also a few of them just to explain what I'm talking about. No, we see the political landscape in a very accelerated transition toward multipolarity, with the fabric of opportunistic alliances that very take.
Sorry for interrupting, Alberto, but I think it's really great. They're trying to bring some fresh air to the room. Unfortunately, it was okay. So we really hope you to feel a bit better now. Thanks a lot. Sorry, Alberto.
No, it's
please.
okay. It's okay. This is much more important.
Yeah.
So yes, as I say, I could mention few of these trends that are being exacerbated now. Let me hook on that. Sorry. There is this accelerated transition in the political landscape towards multipolarity and the fabric of alliances, opportunistic alliances that verily take into account the fate of the vulnerable people. Very interconnected. There is the weakening of the international governance system and the capacity of this system really to prevent the use of violence in conflict resolution, and really the capacity to fix durable solutions to the use of violence. It has been mentioned also by Mike. He say disrespect of IHL. I would use disregard, disdain for IHL, which is much worry to me is that this disregard, it was common among non-state armed groups. It was common among assertive authorities, but now it's common also among states that claim to be defendants of the international order based on binding rules. So this is something that we have to take into account also, no? And we have also this trend of social polarization that has been also mentioned by Anja, and the populism that somehow is becoming transformed in a kind of offensive against international values, no? International values like solidarity, like equity, like compassion, like humanity. So to me, what we are talking about reforming the sector, what we are talking about humanitarian reset, should go beyond money, should go beyond structures. The discussion should go beyond partnerships, should go beyond acronyms, should go about beyond processes. It's about putting the people at the center again. It's about the needs of these people, and it's about the values and the principles that we have to respect as a fertile ground, really to build up whatever we want to build as humanitarian sector. At the end, according to my understanding, what we have now is an offensive against the principle of humanity everywhere. So our duty as sector now is really to work on restoring humanity where humanity is being cornered, where humanity is being targeted, where humanity is being damaged, and where humanity is being destroyed.
Thank you very much, Alberto. For sure, we will come back to the importance of the values and the principles, which is essential for keeping some sort of humanity, as you mentioned. And last but not least, we have Camille Nasban. He already introduced himself, but he's Executive Director, Coordinator of IECAH think tank. So, Camille, I mean, you work on a think tank specialized on humanitarian aid and conflict. And for sure, you have a very interesting global overview. So your contribution for sure is going to be very, very valid for this session. So please go ahead.
Many thanks, Raquel. I mean, I hear really interesting things, so I'll try to build on this, so we can also have some time to continue the conversation. No? First of all, sorry, I apologize because I just forgot something important in the opening. Is also to a big thanks to the University of Seville for this space, and more specifically the Faculty of Psychology, which is maybe the most useful for us, as you can hear. The context is pretty dark, no? So, but let's not giving up. We'll have to find some solutions. We'll have to ask this important question you ask, Anya, no? What can we do? What can we do from our organizations as individuals? And of course, there are important things. There are important principles and facts we should really know and discuss. We are here today to do a bit of this. And we should think from our organizations as individuals, what can we do with this information and these principles, important principles. So maybe some few more info. As a think tank, actually we published every year a report with MSF now for a couple of decades, I think, mostly in Spanish, but now we have a version in English, or most of the report is in English. And what we do with this report, published every year, at the end of every year, is to share the trends in the sector in terms of funding in Spain and globally, and also to highlight some trends and new themes and debates in the sector. No? So from this perspective, we observed in the recent years that this is not new. The cuts, obviously, USAID, this is a huge thing. Huge impact. We presented some of these concrete examples now of this impact, but it came from, as Anya said, from a longer trend. And actually, last year was the first time 2024 humanitarian action funding decreased after from the 2010 increasing every year. Little by little, sometimes not enough. These gaps was increasing and increasing compared to human needs. But from last year, we already observed this decrease of globally of humanitarian funding. And this is from Germany, this is from France, this is from UK, quite relevant, important donors, no? But few donors. That's the problem, no? The system was depending a lot on very few donors, and that's what we can see now. No, what we can observe also, there is this thing from the US, but it's also from Europe. I mean, we had this interesting summit in Brussels, NATO summit, no, last week. So the priorities, the narrative is shifting, and it's quite clear. The clear example is from the UK. No, when they cut development funding and humanitarian funding, politicians clearly explain because it's also good to be clear. No, sometimes, but it's explained. No, the priority is the security. We are going to fund. We need some funds to our army, our militaries, and this is the threats, Russia, and so on. No. Which is obviously something important that can be discussed, no? But what should be discussed is why cutting in development humanitarian response when we are living in a world of crisis, and this is what we discuss just now. it is fundamental to discuss about development, but one of the key obstacles to development are these crises, and there are plenty of studies and evidence about that. There's no development if we are not preventing, we are not managing, we are not responding in the short term, mid-term, long term to the crisis, and that's maybe one of the key message. Just in short, the perspectives for this year, the forecast, we had this 10% decrease last year already, and there are different possibilities this year, but the best scenario is around 30% cut this year compared to last year, and the worst case scenario is around 50%, 40, a lot, 47, 48. These are calculations we will see at the end of the year, but this is the scale, this is the magnitude of the cuts. So it means for sure in 1 year time, should we convene again and discuss, and the system is shrinking and will be not that big in the coming years. And this is pretty much for sure, no? So that's the reality. This said, it's not only about funding. There are other important aspects, and I think we mentioned already. I mean, working together, we are not here to compete with development and saying, well, we'll have to defend. And there are these sort of conversations because prioritization is really one of the big words, no? Prioritization. There is less money. There are plenty of needs and growing needs in most of the cases. So prioritization is really the key exercise. We facilitated some interesting discussions with donors, with different organizations, and I'm sure within the different organizations. And prioritization is always coming more and more in the conversation. So we shouldn't compete humanitarians against development longer terms. Obviously, case by case, and some decisions should be made. But we should really understand that we are all the aid concept is under attack. It's not us specifically as humanitarians or some others development. It's really a paradigm shift, but for bad in this case, no? Against militarism, against aid. So there is this component. It's not only about funding, it's about narratives also, no? This is something we should really discuss. And also to put one more elements, not only about money, it's about, for instance, asking our states to use the humanitarian diplomacy to play an important role, because in many cases, obviously, money is key, is important, but in many cases, we discuss about Gaza, Sudan, and many quite complex settings. This is where the little chances we have to improve the situations will rely quite a lot on these efforts in the humanitarian diplomacy, now from the states to advocate, to put some pressure to change the situation. No? Over.
Thank you very much, Camille. Now, well, I would like to us to have like a sort of more open session, maybe just to break the ice. I have two proposals of questions, maybe one more oriented to Anja and Camille, taking into account that it seems that the multilateral system is at risk or at stake. This disregard of the international humanitarian law, these changes of narratives. So what's your diagnosis, maybe, about the impact of all these three elements in the humanitarian system? And Mike and Alberto, I would like us to focus a bit more and develop a bit more what actually these current crises mean in conflict settings and in forgotten crises. So please, Anja.
On this one, okay. Yeah, no, very good question and a big one. In terms of the multilateral system at risk at stake, I'm not 100% sure that this is true. I mean, I'm always on the side of the optimists, I must say. But I think also what we have seen, or what we are seeing in Seville here, also in the last few days, it looks like there's still a lot of interest in the multilateral system. And the multilateral system, of course, it has been weakened, but at the same time, it is able to come to a consensus, even though it's not the big project that we wanted, and the commitments also have been watered down, but there seems to be still a strong movement of the good people and the good governments these days. And I think we need to build on that. In particular, I actually, from working in the UN, you see that there's a lot of smaller countries in particular that are extremely vocal these days about the value of the rules-based system, because you don't want to be bullied by the big powers, right? You don't want to be put under attack if one of the superpowers doesn't like what you're doing, or wants access to your resources, etc. So I think there is an emerging discussion, particularly from the global south, but also of smaller countries. And I think also Spain is not a small country, it's a very important big country. But at the same time, I believe that also for countries like Spain, having the rules-based system still in place is extremely important. And this is for national security, but it's also for economic reasons and for many others. So I think there's still some, basis that we can work with and should work with. At the same time, I mean, on diagnosis, I already mentioned that 30% of the funding is missing, and that of course has translated directly into a lot of country programs and humanitarian programs that had to be shut down. The majority, of course, in very complex protected crises. DRC, for instance, has been cut dramatically, but also programs in Haiti. And in many other contexts, the Sahel is severely underfunded. And but also situations like in Yemen, where World Food Programme basically had to kick out more than 60% of their recipients out of their food programs. Many of them that are affected are women and children, unfortunately, as always. A lot of the protection programs have been cut at one of the priority ones, the first to go, including also programs addressing gender-based violence in conflicts like Sudan, where we know this is rampant and really one of the biggest risks to women and girls there. So this is really extremely concerning, and it actually puts us back decades, not just in the way how the current programs can be continued, because we're really looking at the bare minimum that is being presented. But if we're actually missing out on all these protection elements, which are part of our mandate, but also on the other programs that are being seen as luxury, like education for children in school, for children in conflict, but also on health, etc., we will actually severely affect the next generations. And there again, this breeds conflict, this breeds unemployment and damages perspectives of the countries, and particular those communities that actually are already underserved. So overall, of course, the impact has been dire. At the same time, I think there is opportunities, and hopefully we talk about this. So localization is definitely something that we are putting forward. What OCHA is doing with our country-based pooled funds, we're really trying to push more and more funding out to local organizations, because this is seen as a model for being not only only more effective, but also more efficient in terms of the funding, while at the same time recognizing local organizations, of course, need broader support as well. But we're really trying to double down on localization through our pooled funds. You might have seen Tom's aspiration for 70% of all funding going to local responders through our pooled funds. So that would be definitely something we aspire to. But I must say we already have good examples. In Ukraine, for instance, over 90% is going to local organization. Afghanistan, for obvious reasons as well. Yemen, we're also at 80%, and over half of it's actually going to women and women-led organizations. So that is a trend we definitely want to further expand on, and especially in times of crisis, because we need to find more robust and sustainable ways of actually delivering humanitarian assistance to those most in need. So just some examples. Thank you.
I can add a few more examples regarding the narrative, which is one of the key things. What can we do is really to think and act, imagine what we sort of changes are needed in terms of narratives. This is about our role, I guess, and localization obviously is one of the. It's not only narrative, it's really how we operate and many principles and many things, but it's also how we should understand our added value and also communicate the narrative. What is aid exactly? Is it really to buy something here and to send it there? So I really help people. I mean, yes, this is the way to go for most of people, maybe when they imagine what is international aid, And obviously localization, it's about big commitments made with the Grand Bargain in Istanbul and all these things, and some mixed results in the last decade. But of course, CBPF, these country-based pool funds are really a good tool. So the funding the decisions are made at national level, and this is really quite a change from decisions made in New York, Geneva, or wherever, in Madrid or Paris. This is, I mean, with many other tools and improvements in the system, it represents really a value, a way to improve the system efficiency and effectiveness of the system, and also ethically to be more connected with the people in need. The difficulty, I mean, the localization should be the solution, but what we maybe should discuss or take into account is that in this context we have with more and more nationalist governments and fewer funds, we'll have to see and we'll have to advocate to make this happen and have a consistent localization implemented, because in some cases it may happen that this will be against localization. Less funds, nationalist governments will want to fund their national organizations and to have another approach to this. So that's a risk, just to stress that. In terms of narratives also, there is this to rethink what's the added value of organizations with our principles, our mandates, of course, but to think about the audience, maybe in terms of generations. They are the newer generations. We are all here very young, this is for sure, but there are some youngest people than us, we can imagine. And this is, I mean, important. This is something we discuss many times with more and more colleagues and organizations, is how to rebuild, develop the narrative. What's humanitarian action? What's the relevance of humanitarian action in 2025? And it's not just about these sometimes simplistic messages. You are giving. This is aid and this is good and this is really simplistic messages. So we should try to build maybe more complex, but connected to the reality messages, and more connected to the reality, and also with these new audience, new generations that may feel different than others. Over.
Thank you, Raquel. So, for sure, and there is no doubt that the greatest impact of what is happening and also what is going to happen is in conflict settings, for sure. Taking into account that conflict settings is an scenario which is already in which there are already not a lot of humanitarian actors now. Is a context in which there is a lot of aversion to risk in conflict settings for several reasons, no? Because it's costly, of course, but also because the criminalization associated to humanitarian aid in conflict settings and the loss of protection for humanitarian actors in conflict settings. So this is already a scenario very complicated already to work, but of course it's going to be worse with the current situation. Actually, conflict settings is suffering a phenomenon of self-censorship by humanitarian actors, because all these difficulties, because all this risk aversion, humanitarian actors are deciding by themselves in their decision making, because there is a huge filter of anxiety and cautious. There is a decision really to withdraw from controversial territories, from hard to reach areas, and concentrate their efforts in let's say easier areas, no, mainly government controlled areas in which the access is easier, in which the risks are fewer, and where the sense of being prosecuted is less, no, is less strong than in controversial territories. So there is a kind of self-censorship that is making conflict settings a humanitarian desert right now. Okay, with the current situation, this is going to be even more exacerbated, no? First, because the high cost of the operations in a moment in which there is no money, but also because the growing of reputational fears on working in conflict, because working in conflict is very linked to controversial issues. Engagement with armed actors is very controversial. ICRC knows very well. You could be very easily targeted, criminalized by counterterrorism policies because engaging with armed actors. Criminalization is also happening when you are assisting illegal migrants, for instance. In conflict settings, there are some components as sexual violence and reproductive health that are also subject of controversies and are very easily used by disinformation and discrete campaign to target the humanitarian actors. So all this self-censorship that is already present in the humanitarian sector to work in conflict is going to be exacerbated, and is going to make that actors remaining, actors still willing to work in proximity, will be more alone than ever in this context. They will be more alone addressing growing needs. They will be more alone, and they will be more exposed to greatest risk, and they will be more exposed to be targeted for these discredited campaigns. Even if you remain, despite all these factors, even if you manage to remain working and to be willing to work in conflict settings, you have to assume that with the current situation, the quality is going to be compromised of what you do, because the humanitarian desert, the withdrawal of actors from conflict settings, means the dismantling of epidemiological surveillance systems, so difficult to detect alerts in terms of epidemiological threats, difficult to follow patterns. The dismantling also of security surveillance systems, so difficult to understand what is going on, difficult to assess the risk, and to really to work on mitigation measures. It will mean also the dismantling of preventive approaches like immunization, which will mean increasing needs, increasing response. It will mean the dismantling of supply chains and the shortage of medical and logistical items in conflict settings. It will mean the dismantling of logistical means for access, for geographical access, like UNHAS, for instance. And OCHA knows that it will mean the dismantling of coordination mechanisms on the ground. All this is going to make that acute situations in conflict settings are going to be more uncertain than ever, with fewer protection and with fewer resources. So at the end, ultimately, is going to be the people in conflict settings, the people suffering the violence, the victims of conflict that are going to be more unprotected than before and more neglected than ever.
I mean, the advantage of being at the end of this table here is that you can feed on what others have said. And I think, almost, trying to connect some dots. And I think it all boils down to political will. We spoke a lot about money, and money is also part of political will, but political will is much more than that. And I think there's a number of ways I would like to bring up the political will. First, we've always faced a bit of a dichotomy between the very visible crises and conflicts and the lost crises and conflicts. DRC, 30 years, still ongoing. What has been a peace agreement has been signed. So let's see, 30 years ongoing. No one really cares except for those affected. You also have today what is even worse, that even the most visible conflicts are where, and there's where I join my colleagues, the norms of IHL and of the Geneva Convention are completely ignored. So even in the most visible ones, so that used to be slightly different in the past. Today, I think that's a very worrying trend. And there, I join what colleagues mentioned. And conflicts are not easily resolved. 70% of recent conflicts are going to be protracted. They're going to last for a long time. There is no political will for resolution. So are we really comfortable with managing conflict? Was that what we're doing now? Because, yeah, of course, the US retreats in terms of funding, but the ripple effects are that people avoid talking about, the things that really hurt and make the difference. And there I join what Alberto was saying earlier. And so what this is actually going to lead is really, yes, a situation where we're not going to invest in resolution, and not in even less in addressing the root causes of conflict. And that's where we talk about the development funding we're talking about. That's supposed to tackle inequality, supposed to tackle poverty, climate change. Those are all the things that contribute also to conflict. So we're just, really gearing ourselves up for, I think, 20, 30 years, if not more, of a very tough time if we don't have that, if we don't really start kicking in some political will to, on the one hand, resolve conflicts, and also reinvest in actually addressing the root causes of understanding why the conflict. Why do we have all these needs today? It's because we're too comfortable in managing conflicts and not avoiding them. The second point of dichotomy that I want to bring up, and that's going, I would like to join Anya in the humanitarian reset. In this current context of humanitarian reset and this thinking that is happening, you have the critics and the skeptics that very quickly put all of us into our little corners. Humanitarian, you do humanitarian. development, you do development, and you better show results very quickly, because otherwise it was a waste of money. Well, then you're going to focus on the safe things. I was speaking to colleagues from the IRC earlier today. You're going to focus on the improvements you can make between 110% and 120%. You're not going to talk about improvements between 0 and 10%, which is the hardest. And I think that is what we have to fight, because it's the easy way out for the international community to put us into the respective boxes and forget about the bridges that we've been trying so hard to make. Sometimes it works, it doesn't always work, it is challenging, but this is where the magic happens, and this is where we have to put the needle towards. So I think really we need to fight. And how do we fight? And I think that's, let's start looking forward also a little bit. I think we've been backwards looking a little bit now, how dire the situation is, but what can we do? And there for us, one way of doing this is, let's bring up the evidence of what works. Let's bring up some of the promising elements that work, the proof of concepts that we've been playing around. I mean, we can talk about the humanitarian development peace nexus a little bit, which, for 5-6 years has been more of a conceptual discussion, but there are some elements of operationalizing the nexus that have worked. So let's not forget those as well. But maybe there's something in there that we can use, and I'll be happy to elaborate on that a little bit. But these are some of the points I wanted to raise. Those two sets of dichotomies that we're always navigating, and on the humanitarian reset, we really have to be careful that we do not get pushed into the respective corners of our mandates. I have a 5-minute clock that I follow very closely, by the way. That's it. Okay.
It's a good news, because we are waiting for the director of the Spanish Agency of International Cooperation. He will do the final remarks, so he's on the way. So he will be with us. But Mike, now we are going to begin with you. So it's gonna be on the other side around. But and let's try, because I would really to get to have some time for, I don't know, opportunities, Ania, or at least long term. But before that, and maybe some 1-2 questions for the attendees here. But so quite fast. But now, I mean, we've been making this diagnosis, but regarding the action, could you, especially maybe ICRC, MSF, and OCHA, to highlight 1-2 hints to choose on how we can preserve the operational effectiveness while safeguarding our principles? I mean, I don't know, Mike, if ICRC is exploring some effective models of collaboration to reach populations. Alberto, what are the 2 main priorities we should reinforce now in the current situation? And Ania, I don't know if you're implementing some sort of measures to mitigate and adapt to the situation. So, Mike, the floor is yours.
No, thank you. I think now we're trying to become more concrete here, and I think there's really 2 examples I would like to raise, and basically is how we demonstrate action and what is still possible today. And this is hopefully an encouragement for political will. A couple of months ago in Goma, the electricity lines have been significantly damaged, where actually power to the hospitals and water and electricity stations have been cut, including laboratories that were storing very sensitive medical samples. So ICRC stepped in with what it does best. It brought in generators, water trucking, and helped to resolve the short term. So that worked, but we had to go beyond. And what we did, and this is where the link with IHL and our role as intermediary, as a neutral intermediary actor, has really helped. We helped to negotiate access for the public utility company to go in and fix the line across the front lines of the conflict, so that electricity was able to be restored. In fact, 70% of the electricity was restored through that intervention. That was for us also a very powerful illustration that, look, this is neutral intermediary work in action that can work. And these are stories that we need to document. They're small. looking at everything that is happening. But in that moment, it made a huge difference. It's not about water trucking. It's not about bringing generators. It's about actually addressing systemic failures and trying to maintain the system. And that's, those are issues that also resonate with those that we want to bring on board in terms of political will. Second example, I would say, is something that for us was always a model. How do we, as a humanitarian actor, make sure that we do not stay 30, 40, 50 years in the same context? That means we need to integrate conflict allowing, an exit strategy mindset. And that means you need to have partners with you to walk that, not partners that just fund you, but partners that you have as part of your operational implementation that you can hand over with. Local, international partners, development actors, development bank. Example, Mosul, Iraq, 2017, really came under massive attack. And again, the water system was at its brink. ICRC worked with the local authorities, local engineers, with systems that have been around for decades to keep up the minimum water provision to the city of Mosul and slowly start to rebuild. And when the situation appeased, we brought in a public development bank, a bilateral development bank, actually, that because of the relationship that we've had with the national authorities, because of our knowledge of the contexts and the results that we were able to show with very primitive and very simple activities, helped to de-risk the entry of that particular development bank and allowed us to basically exit from that context so that we can save the little resources that we have left where it hurts the most. So that is one example. It's not a model yet. It's definitely not a standard, but there's lessons learned from that we can take. And also, let's be very clear, it was anything but easy and it was highly challenging. But again, it's an example that for us really nurtures our discussion where we face similar risks of being caught in, I would say, a very protracted situation. So these are just two examples. There's a couple more, but for the sake of time and spurring the thinking, I would leave it at that for now.
Sorry. Thank you. I will try to describe a bit the internal reflection that we are getting now in MSF, because in order to really to be able to develop and to preserve our operational space in conflict settings, because of course with all the discussions about the humanitarian reset, if finally we all together we manage to address the gaps in terms of money, if we manage to really to organize better the system, the structure, and to put in place a process in terms of efficiency and quality, at the end, nothing is going to work if we don't address also the most important issue right now to work in conflict setting, which is acceptance and access, to be accepted in this type of conflicts. You may have all the money, you may have all the means, you may have the better processes and structure, but if you are not accepted in these settings, there is nothing to do. So somehow in MSF we were managing till now to survive, let's say, as operational model in this type of context, but we know that is going to be more and more difficult. Actors in proximity, as we are, we need to work on a new mindset when it comes to anchoring ourselves, anchoring our presence, and build up acceptance and preserve access in hostile and controversial environments. We consider that our legitimacy as humanitarian actor in these settings cannot longer be entrusted to the obligations of anyone. IHL is not being respected. So right now, for instance, in Sahel, if you try to preserve your operational space and your march of maneuver with the IHL discourse, they laugh in your face. So we cannot stay lying or ability to stay in these settings on the obligations of anyone. Doesn't work anymore. What we are considering really is to strengthen our ability for bilateral engagement with de facto authorities, whoever they are, doesn't matter, and with the communities and the societies being ruled by them. As the international community lose prestige, and this is happening, to be honest, the value of this bilateral engagement increase to open spaces for dialogue, open spaces for mutual understanding, I would say. And it opens spaces also to play our game also in this new concept of transactional aid. You know, aid apparently is not anymore a right. It's a service being provided in exchange of something. Okay, let's play the game. Let's play the game. These spaces of bilateral engagement would be the way of asserting, displaying the quality and the effectiveness of what we do, of the actions, in exchange of access. We play the game. So in a new humanitarian environment without rules, this is what is happening. To be accepted and be able to display the quality of what you do, the quality result of the acceptance that you build up through bilateral engagement are crucial, I would say, for the safety of the staff and for the access of the people in need to medical care and to humanitarian assistance.
So sorry for this. So we are trying to work with governments that actually have a positive outlook in humanitarian financing and using them also as champions in groups. And there are actually a number of good examples also. I mean, Spain is on a positive trajectory on ODA and also on humanitarian. So there's definitely a commitment. There's a law that has been put in place, and hopefully this will be adhered to. Australia, for instance, has also increased. Japan is increasing. Korea is increasing. So there are opportunities. I hope Germany is still coming through, also with the new government, although of course everything is difficult, but nevertheless, you know, we need to preserve some of the funding and at least bridge for the next few years before we come up with new solutions, because we don't have that new magic wand that will give us the money that's actually needed. Also against all these crises that are getting more complex and bigger by the day, right? I mean, we know that humanitarian need is further increasing. It's not going down. This is a reality. So we need to actually work also on financing in a way that hopefully helps us a little bit, or to avoid the worst. Second one is around the efficiency agenda. And here, to be very clear, the humanitarian system is already dramatically changing. It's happening. I mean, if you look at what is happening on the ground, definitely major changes. A lot of national, local NGOs are closing down, others are coming in, etc. But of course, at the moment, there's definitely a major regrouping already happening in the field, and we need to acknowledge this. From our side as OCHA, I already mentioned, we are doubling down on localization. So because we are saying, you know, international when necessary and local whenever possible. So definitely this is what we are trying to do, push as much of the resources down to the local level as possible. Then there's a whole discussion about the common services that, you know, the UN wants to provide at country level, where all the different agencies are coming together, because there's definitely no need for 10 different offices that do data management, right? Or, you know, 500 different reports individually or information campaigns, etc. But also, Alberto, you talked about UNHAS, right? I mean, these are the first ones at the moment that have seen lack of funding. We need to find ways of putting it all together and then operate jointly and not individually. There should be a lot of cost savings in that, although of course it's difficult because it's always about also protecting individual territories. But you know, whenever possible, in a collaborative way, when needed individually, but definitely priority should be given working collectively and not individually, and not only common services for the UN, but for the entire humanitarian community, so also for the NGOs, because that is the biggest thing that we're hearing right now is local NGOs that feel that they're really facing heightened insecurity and violence, etc., and they're actually being cut off services from the UN at the moment on the ground, which is definitely something that cannot happen and we need to reverse. And the third one, and Camille talked about this, is the changing the narrative. I mean, to be very honest, you know, the traditional way of communicating about humanitarian need on the ground and people suffering is not cutting through anymore. People are not willing to listen to this because everyone also feels you know, that domestically there's so many pressures, right? Prices are going up, inflation, etc., etc. So we need to find different ways of engaging. And here definitely we need to talk about the results that we are achieving, the impact that we are making. And I think we have done way too little on this. But also we need to talk about something that speaks to the audience directly, that is talking to, you know, the young people that want to change the world, that still believe in climate change action, etc. So link to that so that we hopefully can create a movement, actually, because we need a movement that is behind maintaining the principles and the values that we talked about. And one thing that's very highly controversial, but I was recently at a meeting where we had partners, also government, but also civil society from the Asia Pacific, in particular from small island states there. For them, they said, okay, the current narrative is all about security and safety, right? And we see that also in Europe. You don't have to go to the Pacific Islands, but it is, right? I mean, it's defense spending is now prioritized. We need to link what we are doing to actually that this is a contribution to increasing security and safety also for future generations. Of course, you know, this is something that we are not necessarily very good at speaking to. But ODA spending, humanitarian action, directly contributes to stabilization, prevention of conflicts, and even further deterioration now that will actually increase national security in the future. So it should be part and parcel of defense spending. That's a bit my pet project, but it needs to be integrated because it is contributing. And the Pacific Islands are mentioned because something we haven't talked about, but what they basically told me was, for us, national security is resilience to climate change. So that is also an issue we cannot forget, and we need to link our movement, humanitarian, not just to development, but definitely also to what is happening in relation to climate change and the overarching climate crisis. Thank you.
Thank you, Anya, as well for bringing honest concerns or proposals or approaches that maybe are not the most politically correct. So it's great. I would like to give the floor to Camille, because I'm sure he's got some points to react, facing what other panelists have said. I know it's a really, really wide question, so I wouldn't like us to be too much theoretical, but in some way, I mean, we would like to finish this table before giving some time for some questions. What's going to happen in the future in the long-term strategies? We already mentioned some of the ideas about what to do, but Camila, I would like, I mean, you to address a bit how far should the humanitarian system should reform? Should we have a reinforcement of the core of the values, principles? It has it to do with narratives, has it to do with the system. So please, we would like to have your opinion, and please, you can react to them, to the rest of the reflections that the rest of the panelists have done. Wow.
Thank you, Raquel. Easy one. No, maybe to add few ideas. So obviously this is a crisis, no? This is the moment. I mean, the word crisis doesn't mean that much, no? We are using, there are plenty of crises. This is a crisis, and actually I think it's a medical term, no? Crisis. This is the moment when someone will die or not. This is the crisis, technically. So in many cases, the crisis is not, it's protracted crisis. This is something that will last, and this is something much more longer than a proper crisis. But just playing with the word a bit. But in this moment, it's, as said, based on the figures, it's much likely that this will shrink, and the funding will shrink in 1 year, 2 years time. This is what we can see with the figures. Then also we can imagine that there's no way back. There's no way in a couple of years, elections in some few countries, some of the big ones like Spain. No, I'm just joking, but the US obviously, and maybe other, not sure we want, well, don't want to talk about elections here. Was not my intention, but it's unlikely that will some more elections, and this trend will change. So this will be less funds from, at least from funds. So there is, we haven't touched that point that much. There is this big thing now, working with other, the private sector, and this is quite a big thing now. I just came back today from Geneva, actually. I was at the World Economic Forum, so one of these big forum, no? So these big actors, alliance from the private sector, they are obviously part of this conversation, but there's no magic solution. There are so many competition right now from all the actors, and traditional actors, from the cooperation, development, and humanitarian action to have these funds to compensate this gap. That this is not the perfect solution, but this is part of mitigating the effect of these big cuts. Actually, I can share one example. This why I was there in Geneva, and this is because you also mentioned this challenge, operational challenges with the supply chain. This is actually a project launched by the IECAH with the European Union, called the High Leadership Group on the supply chain, which is in 1 year time, so quite a challenge, to facilitate a conversation among big actors of the system, the UN, different big relevant agencies from the UN, the movement, of course, and some donors. And the US was part of it when it was launched in December, and they disappeared a few months after that. But some, mostly European donors and European Union and Dubai and few others. And this is to facilitate a conversation to discuss one very specific thing, maybe a boring thing. No, the supply chain sounds like, well, really technical and specific, but which represents a big amount of money in related to our operations, and many times the way we'll be able or will not be able to deliver based on the examples we just had. No, so just to say that again, it is what I can share. It is a good idea. It is really relevant. It's one example. There are plenty different initiatives, no, and big or less big bets from the different actors, donors. But this is an example of what we should try to put collective efforts to see what can be done, to pull resources together, to have the same standards. And this is the moment to do that, because otherwise we'll disappear. But at the same time, to be realistic, it is also what I can see super complex to negotiate with the different agencies. From what you said, Anya, the willingness from the UN to share some of the resources, but then what's the technical standards and the power also from one agency or another. So we are in the middle of different of these initiatives to share resources and improve the effectiveness of the system. So I'm not sure I answered your question, but just to share one more example.
I was aware it was a really wide question. Thank you very much, all of you, for the honest but also constructive, I think, reflection on how the wall of difficulties we're facing can be tackled in some way. I would like to provide some few minutes before the closing remarks to take some questions from the audience. Maybe some of you have some. Please, we will be really glad if you could be a bit agile and concrete with the questions. So please, is there, one, two? Okay, let's go. We don't have, Thank you, Camille.
Yes, thank you so much. I'm coming from Educo. Educo is an international NGO working basically in humanitarian context in education emergencies. So that's why I'm going to ask you, Anja. You said that education is part of that luxury sector. I want to challenge you a little bit. Why do you think is that, and how can we change that narrative? Talking about narratives, we know that education is not just education, is also the adding up of many other rights. When you go like protection, food security, and many others, vaccines, so you have health too. So that will be my question. And the other question, which is not easy, I'm pretty sure we talk about private sector, but I'm asking myself, is there any chance and any opportunity for social impact funds and investors? Do we have the structures for those kind of organizations and investors to be part of the discussions? Is there a niche for them or not? Thank you.
Thank you. Thank you. Coming from Oxfam International, as an organization that is dual development, humanitarian, but also campaigning, advocacy, a bit of everything. And I mean, I think all of you mentioned it, like the main problem behind all this is the lack of political support, the loss of public support in many societies, especially from rich donor countries. So this is where the lack of funding in the end is coming, because decisions are made based on this loss of political support. And the main question will be like how to regain this political support. And we've seen that many times the narratives that work are narratives that take us 20 years back in terms of the debates we have in the sector. Charity logic, the poor child, let's help him, these kind of narratives that we try to run away from because we think that is much more complex than this. But I think, these tensions has always been there between what works in terms of fundraising and what works and what we actually believe should be the humanitarian system, development system that will address the problems we need to address. How we reconcile this now, because the risk is that this is even wider right now. We need political support as much as possible, but the way to get it in the short term might not be the way to get it in the sense of the sector we want to build for the next 20, 30 years. How we reconcile short term and long term now.
Just one question more, and I will be grateful if it's just one question, not two or three. I'm so sorry, but I'm afraid the university, they have to stop working.
Yeah. Hi, I'm Bisrath. I'm from Ethiopia, but a student in the United States for global health and complex humanitarian emergencies. One question that I just really want to ask is, what is the role of the multilateral development banks what is the role in terms of, knowing and lending countries with money, knowing that it's used for war and violence by governments, and what kind of international humanitarian law is there to manage and, control this? And in terms of, I really liked the mention of humanitarian development nexus and how can we, portray the best practices for other development and humanitarian organizations to work together and not in silos. And the other one would be, how can we center women's rights, justice, and GBV? We know GBV being used as a war crime, and how can we, tackle this being sidelined and have this accountability mechanism in general? I know it's a lot of questions, but thank you so much.
Thanks a lot. And I know there is one question left, but after the roundtable, we can, of course, we will be glad to answer the question. So maybe Anya, can we begin regarding luxury education and in which context you mentioned this concept? Thank you.
Thanks a lot. Yeah. Important question, and indeed, I mean, we need to invest in children, right? I'm very clear, and we need to invest in education. I think what we are seeing currently is still something that we are trying also in the humanitarian research to address. The cluster system was like 15 different clusters, leads to strong competition across these clusters in different organizations being in charge for education, for children also. Right? You have UNICEF there, you have UNFPA, you have WHO, etc. All of them dealing with children and women's health, but also to some degree with preventative medicine, with education, etc. There needs to be a consolidation across this so that we really put the people at the center, as also already called there. At the moment, you might have seen that there's agreement already to reduce the number of clusters from 15 to 8, and I think there's still room for further decreases. But overall, I think it's also about monitoring and evaluation in the humanitarian system, because we need an indicator framework that actually demonstrate that people need to receive holistic support, and it's not just one delivery at a time of food packages, but it is protection, it is wash, it is education, it is food, and it needs to, and this then also leads not only to people surviving but also thriving, and in particular younger generations. We are not really measuring this. And I'm actually from the field of global health, and we've always said, particularly working with the Global Fund, you measure what you treasure. Unfortunately, we are not doing this in the humanitarian sector. We are not really measuring what we are doing collectively, and we're not measuring the results and impact in a way that we can also communicate about this afterwards. So this is very important. Shall I also talk about the private sector, or maybe someone else?
You can answer whatever you want.
Okay. Okay. So private sector, actually very interesting. If you look at the statistics and also the latest report, with the US now being out of the picture on humanitarian financing, more or less, right? And I think we need to work with this most pessimistic scenario that they're not coming online, at least not this year, really. The private sector is the biggest funder of humanitarian response worldwide. Granted, there is no private sector as such, because it's many different corporations, individual giving, foundations. They are not a sector as a sector, but private giving is actually the highest. So what are we doing and working, with these resources that we have? And it's not only multinational corporations, it's local businesses on the ground. Local businesses are very often the first responders in emergency, because they know the community, they are there, they have the warehouses, they bring the heavy technology there, etc., etc. So definitely a big question we need to ask, and we need to be very clear that this is a big resource that we need to bring into the sector in a more coordinated manner. On the narrative, I think that's a broader discussion. Definitely, as I said already to colleagues of Oxfam, I believe we need to link stronger to that narrative of security and safety and how we are contributing directly. Because someone has said that there was a Financial Times article and it said, you know, we are now in our countries, even in Europe, we are actually have moved the narrative from welfare to warfare. And it's true. People actually don't, you know, are really concerned about food prices, but we are only talking about how we are increasing defense spending. And we definitely need to be aware that this is, you know, the context we are operating in, and it might not be so easy to reconcile, but it's definitely something we need to do. And the role of the MDBs, of course, they have a very strong role to play. The problem is that most of them are not really investing in fragile contexts. And that is a big, big problem. And looking at how discussions are currently going at these boards and with the different shareholders, they are not going to do this, especially also with the transactional approach that is being used now in all of these discussions. So again, there's actually a lot of pressure we need to put on shareholders, which are our governments, that they change this, because we need the MDBs and they need to be in these fragile contexts. Plus, we also need to bring in innovation. I was just in a discussion on blockchain in development financing. There's all these startups, the fintech, etc., that actually, you know, don't even need banks anymore. But there's a lot of opportunity there, and we need to work with this. The Nexus, very complicated discussion. I would probably argue that we don't have that great examples of where it really works. And we need to rethink that totally. And actually, when I talk to Global South representatives in the UN, they don't like the Nexus as a word as such. They are more talking about from relief to recovery, right? They're much more as a continuum. There's a different. It has been very politicized, actually, and I think also there we need to change the narrative. And maybe GBV someone else can talk to. But thanks.
Maybe just a quick one on the role of MDBs from a different angle. And there are, I think, ways to draw them into fragility. I mean, MDBs is not just the World Bank. MDBs is also regional development banks, and some have apply a better, more sophisticated lens of fragility than others. The African Development Bank has got a transition states office, which doesn't just provide policy, but has funding vehicles as well. So we can nuance that a little bit. For us, what is important is to develop a narrative that speaks also to development banks. And for us, it's the link between international humanitarian law, the protection of humans, and protection of essential infrastructure, which means lower reconstruction and development costs. That's a narrative that resonates with development banks, and also adds a certain element of de-risking into the investment. That's the example I brought on Mosul earlier. So again, while we don't have a model, we don't have a standard, there are examples and lessons learned that we can apply to help to try MDBs into the fragility and conflict area. Maybe just a quick word on impact bonds. Just 1 second. The problem with the impact bonds is that, you know, they're very complex, they're very bespoke. It takes 2-3 years to develop them, and you know, people have very short patience these days. However, I invite you to have a look at the ICRC's Humanitarian Impact Bond, which has been road tested with some very positive elements and lessons learned. All the investors got their money back, so that's good. But how would they even make more money than what they put in? That's the I think that's the $1 million question. Just on that.
May I have a minute for the Nexus issue? Yeah. Okay. We are not very fan of the Nexus approach, as you can imagine. Why? For several reasons, but the main one maybe is that integrating the humanitarian imperative in a wider agenda spanning chronic poverty, climate vulnerability, political insecurity, and counterterrorism, the result has been the cornering of emergency response. which is our business. So all this alignment of goals has been translated into a only focus on the way out of crisis. And humanitarian policy must be able really to hold both emergency response and transition to development. This is not happening.
Yeah. So now we have here to the director of the Spanish Agency for International Cooperation, Anton Leis. Anton, thank you very much, really, for joining us today. We know it's been an exhausting, there are exhausting days with an exhausting agenda, and that you do your best to be here. So thanks a lot. It's a pleasure to have a host country. It's a pleasure to have you here. It's a pleasure to count on with the host country of the summit. So I was going to ask you about the title of the session, Rethinking Aid, Responding to Humanitarian Challenges, and how does the agency face the current context, and what are your bets for the future? But please feel free to do the final remarks as you better consider. So please. Yeah, the mic. Yeah. Do you prefer to sit here? We have a chair.
No, it's okay. I've been sitting most of the day, so
okay.
It's okay. So you said I've done my best to be here, but unfortunately the best was not enough to come on time to follow the discussion, and I'm just coming here to give some thoughts. Look, thank you everyone for coming. It's very important that we have a discussion around humanitarian priorities. When we look at the elements paper of FFD4, the earlier draft, we as a development and humanitarian agency felt that there was no reference to the nexus, no reference to fragility. Spain and a number of other countries push for this. There is a reference. And that's already something. But it is great that you are putting together this event, and there's been, well, it's my third day already. So I think yesterday I was at an event on crisis and fragility with the UNDP and others, and that is very important, because there may be many humanitarians in the room, and you may think that the humanitarian funding situation is bleak. I am actually even more concerned about that missing middle of the handshake on the nexus or the continuum, the way you want to call it. I am very concerned about that, because what we are seeing is a trend in donors to reinforce, or to the extent they can, ring-fence humanitarian assistance. I've seen a few latest news from some very close friends and allies with severe budget cuts that are affecting the humanitarian world more than the development. So I find it a bit puzzling. I see more the opposite, like ring-fencing humanitarian to the extent we can, and then going for, how would I say, like this sort of more sophisticated, private sector-led strategic investments, global gateway type. But in between, there is stuff that is not just very important for people. It's like the provision of basic services. Once the acute phase of the humanitarian crisis subsides, who then takes over? And all of this is being neglected. I frankly hear from some humanitarians saying, well, we are hyper prioritizing. That's not our job. And so, okay, very good. But, I'm on the other end as well, and I'm very concerned, because it's not your job, except that if there is no one there, the humanitarian needs will continue, the crisis will continue, and then we do not invest in resilience, and we do not invest in peace, we do not invest in preventing humanitarian needs from arising in the first place, right? So this is, for me, the biggest topic, I think, or one of the biggest topics in FFD4. And I have to share with you, I'm generally an optimist, and I think we've been conveying a message of optimism in FIBES, but I'm a bit concerned about this. So within the general optimism, I would suggest that those of you that are humanitarians in the room, you do not keep just your head on the humanitarian field, that you look out for this, because our fragility colleagues or resilience or whatever, the people that work in other cycles of the crisis beyond emergency, they need a hand too, because this is an issue. Anyway, I don't need to tell you we're living in very troubled times. I think Tom Fletcher said in the ECOSOC meeting, I mean, I wasn't there, but like I saw a few videos on social media, and one of the things he said is that international politics is becoming more and more transactional, while solidarity and other values are being questioned. And I think this is what we see more and more. Now, we can all become very philosophical, but what I'm going to say may sound a bit naive to some of you, but it is the truth. And frankly, this is something I discuss with people in my ministry and that are not dealing with humanitarian aid or development. They are dealing with security and some other serious stuff, is that these hyper-realists that make a difference between interests and values so sharp are wrong. And for a country like Spain, and I'm sure there may be others, we are in a when we are at our best when we make interest and values align. And I think it is very important to stick to our values now. And I can tell you, in terms of our interests, Spain is getting a dividend on sticking on our values, and that's sticking our values, defending IHL in Ukraine and Gaza. And that is a matter of principle and values, but I can also tell you it is also helping us being influential and having many friends around the world that are, appreciating our position. And I wish others were in the same way. But look, in FFD4, the predictions were that we would not going to get a text. That if we got a text, the text would be weak. Look, it's not a piece of art. Multilateralism is done with poor English and compromise. We chose this Compromiso de Sevilla as the outcome document. It's tricky because I think we meant compromiso in Spanish. The Spanish speakers in the room will understand, but compromiso in Spanish has two meanings. One is a compromise, and there are some compromises there, but it's a very good text actually. And I'm quoting on very good. I'm quoting Professor Ocampo, that has been, analyzing this from the beginning and had some ambitious standards. And he said like 80% of what we propose is in the text. But compromiso also means commitment. And that is actually what I want to underline, because I think we have a good text. People were saying, they be saying, oh, multilateralism is fading away. Solidarity is being questioned. This is a disaster. ODA is going to disappear. Humanitarian aid is crumbling down. Well, that's not happening, and it's actually not the first time that multilateralism delivers in the last few months. We had a pandemic treaty that was hard fought, and also some countries, like including Spain, fought very hard to reconcile seemingly irreconcilable positions. But look, we have a text, and for the last 3 days that we did on the first day, our prime minister was there, we adopted the text, and we've been focusing on concrete stuff. And there is concrete stuff that is coming out from FIBES, those of you that are there, and I'm sure in other discussions you have some things. I think it is very important what comes out from there, because for many donors, it is the same pot of money. We still use ODA. Many of us are thinking that we need to there are some people that say, oh, we need to think beyond ODA. We say we need to think about ODA and beyond. We can call ODA something else. We can call it whatever. There needs to be solidarity. But one point we are making everywhere is that everything we do, every single euro that is in our budgets, in the case of Spain is 4 billion euros a year, is strategic investment. It doesn't necessarily have a financial return, like when we invest in the humanitarian response in Gaza, or when we work on resilience in the Sahel, or when we are working with Haitians on education in emergencies. That may seem as a gift or charity. It is not. It is also an investment in, and I'm choosing this word very carefully, in security, in making the world a safer place. We are living in an environment where security seems to be all over the place. People are, and understandably so, they have fears. An investment in humanitarian aid is an investment in a safer world. And it is not charity, it is something that returns also to the donors and to the donor societies. This is the way we are pitching this. And frankly, the other, when was it? Yesterday, we had a meeting with 40 development agencies. We didn't ask whether donor agencies, recipient agencies, dual. We used to have a world in which you had a group of countries that were helping others. That's no longer what we do. Is no longer what we should be doing, and it's no longer what our people, and that's people in the north and in the south, want us to do. We are talking about partnerships. We are talking about having adult relationships in which people acknowledge the values and interests, and we find common ground. Still guided by global solidarity, because we can always make the argument that that money is better invested, I don't know, as we hear sometimes disinformation and misinformation saying, oh, there is poverty in Spain. Of course there is poverty in Spain, and there is child poverty in Spain. But that doesn't prevent you from lending a hand to someone. And so I think the value of solidarity is still very important. So when we talk about rethinking aid, I'm very much in favor, like, let's rethink it. Let's even ditch the concept of aid to the extent we can. Aid is a word that we don't use. Like, my agency is called IECAH. The letters look like aid, but there is no aid in it. We talk about international development cooperation, and we focus a lot on the cooperation word that in English is not that used. Cooperation means working together. This is what we do, and this is not about aiding anyone. In societies, we have people that are richer, up there above average income, and therefore they pay more in taxes. They receive something in exchange, probably not as much as they give, but they get a society that works, streets that are clean, and streets that are safe, right? So I think at the global scale, that's more or less what we would. So this sort of cooperative environment, I've been seeing it in FIBES, frankly. I know it has come to the expense of a major player leaving the room, but that room has windows. That room has a door that remains open for that player to come in whenever they want. And in that room, there is plenty of people that want to continue working. And that's all of us. And that's not just governments. It is also civil society. It is the private sector. The outcome is not perfect. I am very aware of the challenges. But frankly, I think these last 3 days have been, there are some positive discussions and discussions that I have never in my career seen in the aid discussions. I see things that before we didn't say, we're starting to say them. And of course, I'm very aware that as a humanitarian agency, we are very serious about humanitarian principles, and I'm speaking next to MSF, which are the Bible of these, neutrality, impartiality, the principles, IHL, and so on. But even if we uphold those values to the core, we live in a broader environment in which everything is really connected. And I'm not even mentioning climate, but this is another discussion that is very important. Let's remove the consequences of the climate crisis from the humanitarian bill. We should not be spending humanitarian money, which, by the way, is very expensive. Like, our work is very expensive. When it comes to spending humanitarian money, it is too late. It is too expensive. Let's remove the climate bill from our needs. That would be very important. We have instruments, and there has been progress. The Loss and Damage Fund, which is being operationalized. At the same time, we should start thinking whether for every problem in the world we set up a fund. It's a bit tricky. There are 2 big crises that are important and urgent at the moment. One is, of course, the humanitarian system. We have Tom Fletcher and the Reset working on it. But there is the other one on the global health architecture, which, by the way, today in Spain and others launched an initiative to sort of working with the different institutions and with 12 countries, actually most of them coming from the so-called global south, working alongside us. So we have a crisis of needs. I'm not going to mention the figures. You know them better than me. Needs are exploding. Some of my fellow directors of agencies, they say, oh, you are growing, you don't have cuts. And I say, well, look, everything is relative. The needs are increasing. So in real terms, I'm getting a cut just like everyone else. And what the little money we have it pales in comparison with the needs. The second one is a financial one. Okay, like we already have HRPs at 50%. The US contributed 41%. They say they will continue to do things. We will see. I suspect something? Yes. My concern with this is that we may end up with a system that is smaller, and well, the system will be smaller, that we know for a fact. We know that with this hyper privatization, the global humanitarian overview for 2025 is reducing the people that we are targeting from 178 million to 114 million. That means 65 million people that desperately need humanitarian aid that are not gonna get it, which is, 65 million people. So the system will be smaller, but what I'm very concerned is that we may have a system that is worse quality. We should not go back to track and chuck and like give people bags of rice. Nobody wants that. What is life-saving, and this is what OCHA is telling us, may change depending on the context. We were very concerned with the reset with two things. One, we have been more or less reassured, is the value of protection. That is, of course, very important for us as a principal humanitarian actor. We've been told that there are, the three key pillars. One of them is going to be protection. And then we were a bit concerned about certain regions of the world that may not have the highest levels of intensity in terms of food insecurity and so on, but are still quite important, protracted crisis. A lot in Latin America, the human mobility situation and the funding cuts by the US in Latin America are going to be major. The other thing is that we are a bit concerned about, I heard some questions about education in emergencies. Is this life-saving? Well, I don't know, but it is very important for these children to have a future later on. And, schools are also, we know that in a school you get much more than just knowledge and human capital, right? There are things that you get later. But the crisis that worries me the most, so I said there is a financial crisis, there is, of course, a crisis of needs, but the worst crisis is the crisis of narrative and values. And I think this is the worst of all. I really am ashamed that we are not able to be much more consistent in the messages that we say that we convey. It's very frustrating. I have regularly calls from Spanish NGOs like having their infrastructure attacked in Gaza or losing personnel and so on, and all we do is a press release. Like, we cannot do more, but at least we are doing that. And I don't know where I'm going to be in 10 years time, 20 years time, maybe doing something completely different. But and that's, talking to my family, that's what I tell them is like, we are achieving very little, like, or maybe nothing, but I know that I will look back in time and I'm not going to regret the position I was at, because we need to be very clear. What is happening in Gaza is unacceptable and is a complete and blatant violation of international law, international humanitarian law. If we cannot say this, it is impossible to go to Sudan and to go to the two warring parties and tell them that they cannot target humanitarian workers, that they need to provide access and so on. If the most media-covered humanitarian emergency that we have right now, we as an international community cannot do anything, simply something that is truly, truly wrong. But I'm worried about, the criminalization of humanitarian organizations, the amount of disinformation that our Red Cross colleagues, like the UNRWA, I have been the chair of the UNRWA Advisory Commission up until 2 days ago. Very proudly, by the way, because it's a fundamental organization like to deliver humanitarian aid, but not just aid. And UNRWA is a very good example because they provide basic essential services for people that are, yes, sometimes in a humanitarian situation, but they need those services, which is 6 million Palestinian refugees. So look, we are one of the ones, we feel a bit like the salmon swimming upstream. We are growing our humanitarian budget. Since I am director of IECAH, and this has nothing to do with me, is to a political commitment of our government, and also, unfortunately, to the increase in needs. We have tripled. We have essentially doubled, since 2021, tripled since 2018, but doubled since 2021 to almost 134 million lakhs a year. And we have the regions of Spain. Those of you, there are some Spanish in the room, but this is a highly diverse country. Like, we have also regions, people that are even closer to citizens than the central government, also contributing. Last year, it was 45 million euros. But look, we need to talk to others. The system will not be just with the traditional donors. When they ask me, like, are you a traditional? Well, I said, like, I'd rather prefer to be an emerging donor than a traditional one, whatever traditional means. But we need to talk to others. Saudi Arabia, Qatar, we've been talking to them. There is a lot of promise. Like, then Saudis, yes, on the other ones a bit trickier. and the private sector. That's very important. IECAH knows about this. We are trying to talk to La Caixa and other private actors in Spain. We need them to chip in. They are very interested, but we've been living in silos. We need to connect those silos much more, and also with civil society in Spain. And stay tuned, because we are going to have much more of that. And then, of course, IHL, that's, of course, super important. We need to stand firm on this, and we are part of this process that ICRC launched. Like, we are working with other countries in particular on protecting the medical, on healthcare in humanitarian systems, and we need to stay active. And that is why that means not only doing our work as humanitarians, like providing the finance, doing the work in the field, but most importantly, this is the time to stand up on the political front. And that is why last May, our minister, together with the ministers of France, Belgium, Ireland, and Slovenia, sent a letter to High Representative and Vice President of the European Commission, Kaja Kallas, and to Commissioner Lahbib, to say that we are the #1 humanitarian donor in the world as Europe. We didn't want to be in this position. The Americans decided that this is the position we would be at. We need to lead. And lead means being consistent on the political message. Leading means like increasing the budgets to the extent we can. Our Prime Minister announced 2 days ago that we're going to have a concrete path towards reaching 0.7 in 2030. He has said quite a few things about military spending in parallel, and he has said that investing in global health, investing in solidarity, is also a way of protecting citizens at home and investing in security. So I think these are tough times. I don't question that. But I think there are some piece of good news that is coming from Sevilla, that is coming from the FIBES. And I would suggest that as a humanitarian community, we work with the development people, like much more, and we start building a new and rethinking a new architecture that stands by the very best of humanitarian principles in IHL, but that enriches it with the influence of others, actors that have been marginalized, that have been knocking at the door, or maybe not knocking at the door, but we need to certainly bring them in. So, sorry, this is late. I was late, and I've spoken probably very long, but I just wanted to share some ideas. And again, thank you for coming to Sevilla and for handling this extreme heat. Thank you.
So, thank you very much, Anton, for your words, for your reflection. Thank you very much, all the panelists. It's been really a pleasure to count on you and to have this open and honest conversation. Thanks, really, all the attendees to be here after 3 exhausting days. So we're really, really grateful. We can say that despite all the tremendous challenges we have, there is a greater need than ever for solid humanitarian action anchored in essential principles and values, and that puts people at the center. Don't forget the populations, please. Don't forget that all that the things we are doing have a direct target, that are populations. They always should be in our narrative. We have a shared responsibility to give our best and to do so in the best way possible to preserve the space of solidarity, of humanity, of protection and aid for the humanitarian action. Thank you very much.
Can we have a photo with everyone?
Crisis.